Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Headache from low blood sugar, hypoglycemia. Low blood sugar can cause and worsen headaches. A hypoglycemic headache can feel like dull throbbing in the temples. If you get migraines, low blood sugar may trigger a migraine episode. /r/n/r/n This article discusses why low blood sugar can cause headaches and migraines, as well as how you can prevent and treat them. /r/n/r/n You may get a headache when your body's glucose, or sugar, levels drop below 70 mg/dL/THE benchmark for hypoglycemia. /r/n/r/n Headaches from blood sugar this low are usually described as a dull, throbbing feeling in the temples. The pain can occur with other hypoglycemic symptoms, like blurry vision, increased heart rate, nervousness, fatigue, irritability, and confusion. /r/n/r/n If your glucose levels are not brought back up to a level between 70 to 100 mg/dL quickly, then symptoms can worsen to include numbness, poor concentration, poor coordination, passing out, and even coma. /r/n/r/n Hypoglycemia can also trigger a migraine headache. In fact, some people who get migraines report craving carbohydrates before the migraine hits, which may be the body's way of regulating blood sugar and attempting to prevent the headache. /r/n/r/n Migraine headaches caused by hypoglycemia may not be accompanied by typical migraine symptoms like nausea, vomiting, and sensitivity to light and sound. Instead, the migraine is more likely to be accompanied by the hypoglycemia symptoms noted above. Although, this is not a hard and fast rule. /r/n/r/n Hypoglycemia is also common in people with diabetes and may occur when someone takes too much insulin or diabetes medicine, takes the medicine at a different time than usual, waits too long to eat or doesn't eat enough, exercises at a different time of day, or drinks alcohol. /r/n/r/n To prevent your hypoglycemia-induced headache, it's best to prevent your blood sugars from dropping. /r/n/r/n If you have diabetes, it's important to follow the medical management plan established by your healthcare provider. /r/n/r/n Be sure to check in regularly with your healthcare provider so they can monitor you for any changes that may affect your treatment plan. /r/n/r/n Hypoglycemia-induced headaches can occur when you are fasting. This is because your body isn't able to maintain its glucose levels if you're not eating anything. /r/n/r/n Healthcare providers generally suggest that people who have hypoglycemia eat smaller, more frequent meals and snacks throughout the day. In addition, it's advised to go no more than 3 hours between eating meals. /r/n/r/n A well-balanced diet rich in protein and fiber will also help maintain your blood sugar levels. Excessive alcohol and sugar consumption can cause hypoglycemia, so sugar and alcohol should be limited, especially on an empty stomach. /r/n/r/n Regular physical activity is another important management technique. /r/n/r/n Some other causes of hypoglycemia include chronic illnesses like kidney disease, overproduction of insulin by the pancreas, or other endocrine-related issues. /r/n/r/n If you have any of these conditions, it's important to talk to your healthcare provider about treatment options that may help improve your condition and prevent hypoglycemic headaches. /r/n/r/n It's important for people with hypoglycemia to have their blood sugar monitor and a snack with them at all times. If your blood sugar dips, you need to get your glucose level back up between 70 mg/dL and 100 mg/dL as quickly as possible. /r/n/r/n If you are hypoglycemic, or think you might be, follow the 15-15 rule to feel better fast. Consume 15 grams of carbohydrates and then wait 15 minutes. Then, /r/n/r/n If things don't improve, Call 911. /r/n/r/n You need to choose a food that is nearly pure carbohydrate. The protein in peanut butter crackers, for example, will slow the quick absorption of carbohydrate that you need when hypoglycemic. /r/n/r/n Good options include /r/n/r/n Sometimes, hypoglycemia will cause a person to pass out or lose consciousness. Be sure to not try to feed an unconscious person with hypoglycemia, as this can cause choking. /r/n/r/n You may also take OTC Tylenol, acetaminophen, or Advil, ibuprofen, if the pain doesn't subside right away. /r/n/r/n If you are concerned about your symptoms or the headaches don't subside with one of the quick fixes above, consult with your healthcare provider and get a ride to the hospital. It is very important not to drive yourself when having a hypoglycemic episode. If there is no one who can drive you, call 911./r/n/r/n Keep your friends and family informed about ways they can act quickly to help you with a hypoglycemic episode. /r/n/r/n Hypoglycemia can cause a dull, throbbing headache in your temples. These headaches often occur alongside other symptoms like blurry vision, fatigue, and confusion. /r/n/r/n Hypoglycemia-induced headaches can be prevented by making sure your blood sugar levels don't drop. If you have diabetes, make sure it's well managed. Regardless of the cause of your hypoglycemia, it's important to eat a healthy diet and avoid letting too much time pass between meals. /r/n/r/n When you get a hypoglycemic headache, the most important thing to do is get your blood sugar back under control. If eating carbohydrates doesn't help, seek medical attention right away. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.